Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Your dog has a slight cough or might be drinking a little more water than usual. Your cat's lost a little bit of weight but hasn't missed a meal. Or your rabbit seems to be breathing a little faster. Today, we're taking a closer look at some subtle symptoms that could be more serious than they appear, as well as answer your other pet-related questions on this episode of Ask the Doc, No Appointment Needed. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Joy Carter, a doctor of veterinary medicine, and today we're focusing on subtle symptoms that could actually turn into something more serious. Our first question comes to us from Luna, who just reached out to us through our website, allhealthtv.com. All right, Dr. Joy, our Lhasa Lacey has developed a slight cough. I think it's probably allergies, but my wife is concerned it could be a heart condition. What do you think, Doc? All right, Luna. So it's a little bit hard to give a definitive diagnosis without seeing Lacey, but here are my thoughts. All right. When it comes to a cough in a pet, sometimes it can mean something more serious, and sometimes it may not be anything serious. One thing that I ask typically, owners is obviously age of the pet, any underlying prior history, such as history of a heart murmur or anything like that, especially older pets that have a history of a heart murmur. There is a concern when they have a cough, because a cough can sometimes indicate that they might be going into congestive heart failure. And that is typically when we can start to see fluid in the lungs or fluid within the chest cavity. Now, also, too, sometimes if they have a heart murmur and there is actual active heart disease, that heart gets so big that it can put pressure on their trachea. And so that can cause them to have a cough also. Now, typically, when I start to get concerned about the cough, that it may be something more serious, typically when it is a wet type of cough, okay? And also, too, when your pet is also lethargic, say maybe even feels warm or has a fever, decreased appetite or no appetite at all. And obviously, if you are noticing changes in their respiration, so if you notice that they are breathing more faster than normal or breathing more heavier or using more of their abdominal muscles, that is definitely a concern. Times when I'm not so concerned about cough is when you say have a young dog or a puppy, they're otherwise being active, they're eating okay, and they tend to have more of this kind of dry cough. A lot of people will come to my office and say, hey, doc, it sounds like my dog's got something stuck in his throat. That is very typical of the cough that we tend to see with some what we call upper respiratory disorders, which tend to affect like the trachea or the windpipe, such as like kennel cough or tracheitis, or something called collapsing trachea, which you can see in the smaller breed dogs. But I will say this, if you have any concerns about your dog coughing, okay, or even if your dog is otherwise acting fine, if it's not resolving in a few days time period, you definitely want to go get your pet checked out by the vet to make sure that it is not something more serious. All right. So you are correct that technically kind of some allergies and some upper respiratory things can cause a cough. But just to be on the safe side, Luna, I would maybe let Lacey go get checked out by her vet. All right. Our next question is from Killian, who reached out through our Facebook. Hi, Dr. C. Our King Charles Spaniel William looked a little weak and then collapsed suddenly. We were obviously very concerned, but 20 seconds later, he bounced back as if nothing happened. Should we be worried? Hi, Killian. Thank you for sharing your story with us. Yes, yes, yes. You should be concerned. Anytime you have a pet that collapses, even if they seem normal after a very short time period, that can indicate something a lot more serious. In particular, King Charles Cavalier Spaniels are known to develop heart problems, okay? And syncope episodes are basically passing out. Those are some signs and symptoms that you can see with a pet with heart problems. All right. So it may not seem like anything that serious at that time period, but there definitely could be a lot more serious underlying problem, especially with their heart. Now, sometimes it could also indicate a neurologic problem. Okay. You have typically what you call like your grand mal seizures. That's the seizures that everybody is used to seeing, where the pet gets really stiff, they start paddling or having tremors. Sometimes they'll urinate or defecate on themselves, like they basically become unconscious. But you can have seizure-like episodes that are what we call petit mal seizures. And they can vary from just like kind of almost passing out for a quick second and then waking back up to having what we call like fly biting or gum chewing fits or like focal seizures or tremors on one part of the body. So yes, Killian, okay? Especially with your dog being the breed that he is, definitely go get him checked out, okay? Remember, early intervention is the key for a lot of diseases, just like it is in humans. Same thing with pets, guys, okay? All right, we got another Facebook question, and this is from one of our loyal viewers, and this one is from Dakota. Hello, Dr. Joy. My tabby, Tatiana, occasionally vomits or coughs up a fur ball or two. I'm assuming that's normal. What's not normal? Hi, Dakota. I love your name. It's so cool. And I love your cat's name too. All right. So, a lot of times, coughing up fur balls or vomiting up fur balls is not necessarily a serious problem. Okay. There are some things you can do to try and help your cat if they do have an issue with fur balls. Definitely keeping them groomed on a regular basis. There are some diets that are really good for hairball control. And another thing too is there's some supplements like laxatone and things like that that can help make it easier for when they do ingest the hair for easily to pass, for them to be able to defecate it out. Now, a lot of times though, I will have owners come in with a cat. So they say, hey, dog, my cat's just making this weird coughing noise. I think it's trying to cough up a hairball, but I don't see anything come in. A lot of those cats may be developing asthma or have feline asthma. It is very, very common in cats. And certainly cough is one of the number one symptoms that we tend to see. Now, as things progress, we can start to see symptoms where they can actually start having trouble breathing and even go into what we call like an asthma attack. And those can be life-threatening and that can require emergency treatment. So it's definitely better if your cat is coughing and you think, you know what, I think it's hairballs, but I don't see any hairballs, go get them checked. Okay. And honestly, I have seen cats. It's very, very rare, but I think they're hairballs. The medical term is trichobizars, or bizarre, excuse me. They can cause obstruction and blockage. I haven't had to do a surgery in a cat in a very long time for that. I actually had to do a surgery in a dog for a hairball that got stuck, but that can be another problem. Okay. All right. Our next question comes to us from Jessie, who just visited us on Insta. Hello, Dr. Carter. My cottontail rabbit Peanut hasn't eaten in about 8 hours, which is a record for him. Am I overthinking it, or could there be a legitimate problem? Hi, Jessie. That is a really good question. But before I answer your question, I kind of want to go over some things, some common signs of illness in pets that we don't need to ignore. All right. So as you guys can see, first one is going to be changes in appetite, and that can include eating less or even eating more. Obviously, weight loss or even weight gain. Being lethargic, being less active, that's definitely another one. Vomiting or diarrhea, I see that every single day in my clinic. Breathing issues, 100%, just like we talked with coughing, hair loss can actually sometimes mean something more serious. If they're having bad breath, drooling, trouble eating their food, things like that. And then sometimes just overall behavioral changes. That can sometimes indicate something more serious. So watch out for the signs and symptoms, guys. And if you notice those, definitely make an appointment with your vet. All right, so let's get back to your question, Jesse. So yes. Rabbits pretty much eat very, very frequently. Okay. And if your rabbit has gone more than 4 hours without eating food, that can indicate a very serious condition called gastrointestinal stasis. Basically, what that means is the food is not moving through the gut and the intestines like it's supposed to. Okay. As you guys probably remember from biology, rabbits are herbivores, okay? Their diet typically consists of a lot of hay, a few pellets, and a lot of vegetables, okay? They need fiber in their diet to be able to ferment this food and for things to pass. And if they're not producing feces and they're not eating after several hours, then that definitely can be a concern and you need to bring your rabbit in very, very quickly. Now, as far as the cause of what can cause GI stasis, sometimes stress is a really big one, sometimes changes in their diet, and sometimes even like an obstruction. Just like cats can get hairballs, rabbits can get hairballs, and they can actually get obstructions and sometimes have to have surgery for that. If it's not something that's surgical, there are a lot of times some things that a veterinarian can do to help make your rabbit more comfortable and treat the condition. Usually that can require fluids, whether it's IV fluids or sub-Q fluids. There are some medications sometimes to help with the motility of the GI tract. And just even you feeding them, okay, trying to kind of syringe feed them. Pain medications are another big one because a lot of times there's a lot of discomfort. So definitely, I hope everything's okay with Peanut. I'm a little bit worried, but if you haven't already gone to the vet, let's get Peanut to the vet ASAP, okay? All right, so on to our next question. This one is from Adeline, who reached out through YouTube. Doc Joy, my poodle mix Felix has been somewhat lethargic and his abdomen looks a little distended. I'm not sure if he got into something or not. What should I do? Hi, Adeline. All right. So it's hard for me to diagnose, this without seeing him, but I would definitely recommend bringing Peanut in to see, sorry, not Peanut, Felix in to see the vet. Okay. Whenever we have a pet that is lethargic and the abdomen is distended, there are a couple of things we're worried about, okay? Obviously, they could have a mass or a tumor on one of the organs in the abdomen. They could have fluid in the abdomen that could be developing. Now, as far as what type of fluid, if it's blood or something else, as far as a cause, that's something else that your vet would find out by doing tests. But that it's never, ever good for your pet to have fluid in its abdomen or any body cavity for that, matter. Another thing that we do get concerned about, and we see this more in the larger breed dogs, and especially dogs with a deeper chest, is something we call bloat, or also called gastric dilatation and volvulus. And all of a sudden they can become very large. They can try to vomit or retch and nothing comes up, and they will have a very swollen and very distended abdomen. All right. Hopefully it's not anything too serious with Felix, but definitely this is a symptom that you do not want to wait on. Okay. So please, please, please make an appointment with your veterinarian. All right, we got another question from our website, allhelpstv.com. You guys should really check it out when you have a chance because it is a chock full of great information. And this question comes from Hudson, who asks, Hi, Dr. Carter. I'm cat sitting my girlfriend's cat, a Highlander named Fiona. Fiona has been acting pretty hyper the past few days, and being that our relationship is still kind of new, I'm not sure if this behavior is normal or not. Thoughts, Doc? All right, Hudson. So, major brownie points for doing the cat sitting thing for your girlfriend. As far as your cat being more hyper, or your girlfriend's cat, Hudson, okay? I'm not really too concerned about that, all right? I typically do tend to get more concerned when pets are lethargic. Now, if your girlfriend's cat is an older cat and is very hyper, Okay. That could sometimes indicate what we call like an endocrine disorder, kind of a metabolic disorder, something called hyperthyroidism. Okay. Basically, too high levels of their thyroid hormones. That can sometimes cause it. Typically, it's not like a medical emergency, but it is something that you want to get checked out. It's very easy to diagnose this with some blood testing. Other reasons your cat can be hyper can just be sometimes cats are weird. And there's a new person in the house and they might be a little bit stressed. Some cats will hide when they're stressed, and I've seen some cats that will be very active. Or maybe your girlfriend's cat really likes Shoe Hudson. I know that my cat is super friendly to everyone that comes to my house. And so she's always purring and moving around and doing things like that. And something else to think about, I don't know how old your girlfriend's cat is, Hudson, but if your girlfriend's cat is young and she is not spayed, it kind of may be that time of the month for her. And a lot of times they get really hyper and a little bit friendly. Obviously, the way to fix that is with getting her spayed. So I would, though, Hudson, definitely mention it to your girlfriend when you get home. Hey, your cat was a little hyper. And obviously, maybe she may want to take him or her in to get checked out, but it's not something that I feel like is an emergency. So hopefully I answered your question, and good luck with the pet sitting, Hudson. All right, we got another question from Facebook, and this one is from Chloe. Hi, Dr. Carter. Our chow's gums have begun to look, I guess, kind of pale. Is that possible? And if so, is this something that we need to be concerned about? All right, Chloe, before I give my thoughts on this, let's check out this video from the folks at the Mayo Clinic.
Do you wash your pet's food and water bowls regularly? If not, you could be creating an environment that harbors salmonella, which can infect both you and your furry friend. While salmonella is a common cause of food poisoning, it can also be spread by animals and their environments.
Salmonella is a bacterial infection that people can get from touching contaminated food or through contaminated water, or perhaps from their pets and their food and their feces.
One of the best ways to keep yourself safe from salmonella is prevention.
So that requires us to wash our hands consistently, be thoughtful about washing your pet bowls, be thoughtful about their food, wash your hands after you handle certain animal environments, maybe their beds, sheets, that sort of thing.
Young children, older adults, and people who are immunocompromised are especially at high risk of getting sick from salmonella infection.
Most patients will recover on their own. Some patients may have more trouble and be so ill that they'll require things like IV fluids, perhaps hospitalization, and in rare cases, antibiotic therapy.
For the Mayo Clinic News Network, I'm Dee Dee Stephen.
All right, we're back, guys. But before we answer Chloe's question, one point, okay? So there's a lot of controversy about raw food diets, okay? Raw food diets, I personally do not recommend them, and most veterinarians don't. The big reason is because of concerns about contamination, in particular salmonella poison. Another thing here, guys, to think about, and I know I've talked about this on other episodes, grain-free diets are now causing heart problems in dogs. It's something that we did not see many years ago, but because of this whole kick of feeding your pets grain-free food, we are now starting to see dogs develop heart problems because of this. And it's actually called grain-free cardiomyopathy. All right, so two things for you guys to remember. All right, let's get back to your question, Chloe, about the pale gums. Yes, yes, yes. Chloe, this is 100% an emergency or something that you should go get checked out right away. Now, I cannot tell you the reason that your dog's gums are pale, but one concern would be that your pet may be anemic, okay, or developing anemia, which is low red blood cell count, and that certainly can be serious. Now, as far as the cause of that, there's a lot of different things. Sometimes it can be something as simple as intestinal parasites or even external parasites. If your pet has a lot, those can cause anemia. That's usually easily treatable. Other more concerning causes can be some autoimmune disorders that can cause your body to break down the red blood cells. Or I've seen it in a lot of older large breed dogs. They can develop masses or tumors in their abdomen that can suddenly rupture, and those can start to bleed, and that can cause your pet to become anemic, okay? Other things can sometimes be low blood pressure, like what we call poor perfusion of the blood vessels. That can be because of issues with the heart, things like that. So all these problems that you tend to see when a pet has some pale gums are serious. So definitely make sure you take your pet into the vet as soon as possible. All right, Chloe? All right, the next one in the queue comes to us from Amara, who was on our Instagram page. Doc Joy, my rabbit's poop has gotten very small and infrequent. What's the deal with that? All right, Amara, that's a really important question, okay? When it comes to rabbits, like we talked about with the other question, their gastrointestinal tract is health, as far as their health, is very, very important, okay? Rabbits kind of produce two kind of different types of poop. One of them is called like cecotroph. Those tend to be kind of small, round, a little bit softer. And then they actually do kind of what we call like fecal pellets. Those tend to be a little bit kind of firmer. They should be pooping constantly. Okay. Rabbits poop all the time. And a lot of times they will even eat their feces or the cecotrophs. Sometimes you see it, sometimes you don't. They do that at night. So if you're noticing that your rabbit is not as pooping as much as it should, it can definitely indicate something else going on, which may or may not be serious. Obviously, when it comes to any of the pocket pets or kind of the exotic breeds, they are very, very sensitive and they can get sick very quickly and they can unfortunately pass away. All right. So they need to be seen a lot sooner, than maybe you would with your dog or your cat, which you guys should be bringing them in if there's a problem. But I'm just saying, definitely with the pocket pets, you want to get them checked out sooner. So definitely. All right, Amara, let's make an appointment with your veterinarian and let's get your rabbit checked out. All right, this is our next question. It's going to come from Zeke, and he reached out to us through YouTube. And this is probably going to be our last question, guys. All right, let's see if we can get through this. Hi, Doc. My bulldog Maximus is suddenly drinking a ton of water and peeing constantly. Is it safe to assume that this is quickly becoming an issue? Hi, Maximus, or sorry, hi, Zeke. And hi, Maximus, too. Okay, listen, yes, okay? Drinking a lot of water and peeing a lot, urinating a lot. That is a very common sign that we see with diabetes. It is another common sign that we see with another endocrine disorder called Cushing's disease or hyperadrenocorticism, okay? While most of these, conditions are not immediately life-threatening, if they go left untreated, they certainly can cause problems, okay? As far as diabetes goes, we actually have, insulin to treat that. And in cats, we have some newer treatments, which I've talked about in past episodes. So it is something that can be treatable, all right? But you need to have it diagnosed. And one of the common symptoms we see is going to be drinking a lot of water and then urinating quite a bit. The same thing with Cushing's disease, okay? Cushing's disease is when they produce too much of the stress hormone called cortisol, okay? And think about it, guys. If you're producing too much cortisol, same thing in humans, okay? People that are really stressed out and have high cortisol, it affects everything in the body, all right? Why it might not be like an immediate life-threatening, you need to run them to the emergency clinic, it definitely is something that you want to have your pet, if they do have it, you want them to be diagnosed and you want to start proper treatment because it can affect their overall quality of life, all right? While I hope that Maximus does not have either one of these conditions, Zeke, definitely get him checked out. And there's some other things too that can cause it that are less frequently. Sometimes issues with the kidneys can cause it, things like that. But your veterinarian is going to know what to do. Okay, with Maximus, it's probably going to want to run some blood work. Definitely going to want to run a urinalysis to check the urine out and hopefully get a diagnosis and hopefully get treatment started. All right, guys. So that is all the time that we have for today. I hope you guys had fun listening to me. This is a really good topic, especially since I've been doing emergency medicine for a long time. All right, guys. I will see you next time. Bye.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.